Hi, I'm Mr Mark Jeffery. I'm a Consultant Orthopaedic Surgeon at the University Hospital of Lewisham. I joined Lewisham just over a year now, so I joined in June 2009. So my job currently entails really evaluating and treating those with upper limb musculoskeletal problems. I do other orthopaedic work as well, but my main focus is in that area. As a lot of orthopaedic departments do, we tend to divide the work line down, those taking the lower limb problems, we take the upper limb, and we obviously work as a team, referring to each other and discussing things with each other to try and sort of get the best management for the patients as they come through the door. This is quite enjoyable, the team aspect of it. It's good to speak with your colleagues. I also have a good colleague in upper limb surgery who I can discuss things with, and that's educationally interesting. I also enjoy the fact that we have quite a lot of trainees who come through, and also medical students, so the educational side of things is also rewarding and challenging as well. As a relatively new consultant, I have a lot of plans in terms of what I'd like to achieve with the post. There are obviously personal development plans, but also I would see myself as trying to develop the educational side here as much as possible. That would involve obviously the teaching of the medical students, which I'm very involved with at the moment, and also the postgraduates as well. But taking things on from there, I would also like to consider whether or not there might be some use in some teaching or educational days for the local general practice population, and also nurses and physiotherapists as well. I'm sure it would help in terms of our treatment and streamlining patients. In addition, from my own perspective, there are certain things that we've achieved here already at Lewisham. You may have already heard of our carpal tunnel service, where we can get very rapid, almost one-stop EMG studies and therefore offer people surgery very quickly, which has been quite successful so far. Obviously we'd like to take that even further if it's at all possible within the constraints of the service, and that would be really looking at perhaps even the one-stop clinic where they come in, have their assessment, have their EMG, and possibly even consider having surgery at the same time. And that may not be possible to achieve, but it's worth at least looking at, see whether it may be possible. Taking the one-stop idea further on, I have had some training in ultrasounding of shoulders, and I would like to sort of take that further on. I would probably need a little bit more training and then the facilities to actually do that, but that would certainly be something I would look at, because it would probably, if I could image some of the shoulders, would speed up the throughput and the efficiency in the clinic, and I think it would also add to patient satisfaction rather than waiting around several times for different clinic appointments and discussions. All of these things that I'm suggesting and thinking of really are looking towards enhancing the service that we have here at Lewisham, which is already good. It obviously is important to improve our service with good communication with our colleagues in general practice, and I'll be really grateful for any feedback.